Hi, Jennifer Penrose here from Penrose Physical Therapy, and today I'm going to talk about releasing your hip flexors. And that is a muscle on the front of your hip that also attaches to your lumbar spine and can create a lot of back pain, hip pain, can lead to all kinds of problems really. If you do a lot of sitting, driving, desk job, hip flexors are in a shortened position, so then they get tighter. A lot of athletes tend to be quad and hip flexor dominant. So that's another population we see a lot of that. So this is something, if you find if someone works on you massage-wise or releases your quads and hip flexors, the muscles on the front of your hip, and you notice less back pain, you will want a daily maintenance routine of stretching and self-release of those structures. So there's a couple different tools. This is a lacrosse ball. It's pretty firm. I'm going to show you how to use that. And then there's different size foam rollers, but you want one that's fairly dense. And I'll show you how to use that and a couple stretches. There is a thing out there called psoas right. And it's basically a plastic platform like this with two projections sticking straight up. And you lay on your stomach with those 2 points, kind of going right into your pelvis, kind of where I'll show you with the lacrosse ball where that's gonna go. And I have some people who swear by that psoas release. So, and psoas is P-S-O-A-S. So if you're looking for that tool online, the psoas light, I think is what it's called, you'll find it. If you go for psoas release tools, you'll find things online, but basically it's a plastic platform and these two projections. So let me start off with showing you how to use the lacrosse ball. I'm just gonna set my camera there. Here's the ball. And you're trying to, your psoas, if you find your crest of your hip right to that inside of that, that's where it goes. So for some people, it's kind of hard to figure that out, but crest of hip, come on over to that area and you're trying to sink into that ball when you're on your stomach. So you kind of are gonna roll around a little bit and then you'll find, you wanna be on a pretty firm surface, not on your bed. So the firmer the surface, probably better to then get into that spot, and you can kind of scooch a little bit if you want to find some other areas that are tighter too. But that's basically just to the inside of that bone, and then just kind of breathe and relax into it. But you can see if that feels good or you feel like you can't get deep enough, how those projections of that other plastic tool I was telling you about can get in there. So that's a good, you know, my quads are fairly tight, so rolling around on the ball feels pretty good. You can just kind of use your forearms to move around. So that's how you get in there. And I would stay there for a couple minutes. Foam roll, again, you can have different sizes. This one's a nice size to travel with, but you would just go ahead and roll that quad out on the front. And then you can also get up high into the hip, and I can lean more body weight onto that side and find some good spots, kind of even turn a little bit to get into that top spot. When you find a pressure point, you can just kind of lean into it and do some deep breathing. It's not fast rolling, it's kind of slow, and then find spots that feel like it would let go. So foam rolling, the lacrosse ball, and then stretching it. You have one leg up in front, and you just kind of lean forward to get that nice pull right through here. Now, to make it more advanced, I could have my foot up on a coffee table or the wall behind me. So if you can picture that up, I can kind of get that there. That's gonna stretch it even more through here. I like resting it on something because then I'm not working at balancing. When you're stretching, you're trying to let go and not contract your muscles and hold that there. So I like having it up on something if I'm gonna do the advanced one. So that's a pretty good hip flexor stretch. You shouldn't feel it in your back. It should all be right in here. And hold it for 15 to 30 seconds. Repeat it several times on the other side. So if you really struggle with back pain and you find that releasing the hip flexors and the hip muscles on the front give you relief, then just develop a routine of releasing those. Try to stand more if you have a sitting job if possible, or get a sit-stand station if possible. So those are my tips. Thanks.